Dr. Subhashini.
Very good morning to the dignitaries present on the stage and my seniors and colleagues. I'll be presenting on Thesis to Publication, Unveiling Hurdles in the Pursuit of Publication from a Resident's Perspective. Background of the study: research is an integral part of residency, where working under mentors plays an important role in setting the ground for further exploration in the field of research and publication. Why research? A study conducted by Nair and et al. Concluded that perception of residents towards research include enhances critical thinking, it adds to their knowledge of medicine, it acts as a stepping stone to publish scientific papers, and it enables recognitions among peers. Data from our institute reveals that 15.2% of our residents have published their thesis. Aims and objectives of the study include to understand the hurdles in converting thesis to publication and to identify phases of the thesis journey where residents appreciate guidance. A validated questionnaire was administered to ophthalmologists who have completed residency from our institute in the last 4 years, and the results were analyzed. Out of the total responses received, 24% had published, and where are they now? 20% are medical consultants after subspecialty fellowship, 16% are general ophthalmology practitioners, and 44% are pursuing their subspecialty clinical or research fellowship, and 20% were residents who had just finished their exams. What was the motivating factor for thesis publication? For most of the residents, it was a mentor or guide who pushed and motivated them to start the work, and for us, it was interest in research and as a requirement for job opportunity or fellowship. Guidance was required at which stage? For 50%, it was language, and for the rest, it was choosing the right journal, statistical analysis, and writing the right conclusion. Reasons for delay in publication. A whooping 52.2% agreed that it was lack of time, and for the rest, it was lack of motivation, delay in acceptance due to rejection, as they had to edit their manuscript multiple times after that, and miscellaneous reasons like being engaged in other projects or applying for fellowships or just busy being in life. When was the thesis published? 56% who had published had started their work within 6 months of completing their residency, which means whenever earlier work is started, there is always an earlier chance of success as they're already on track. A lot of theses have more than one parameter being studied. So the question was asked, if a single parameter or an objective was considered for refinement and publication, was there an earlier chance of success? And 36.4% agreed so. What will actually help? Periodic review with mentor in the form of Zoom calls or face-to-face meeting whenever possible. Consistent dedicated time for thesis in the form of 2 to 3 hours per week. Being updated with a study coordinator with the thesis timeline. And working with a catalyst co-author. A catalyst co-author is a person who has experience in publication, who has contributed significantly to scientific journals. Adding them as co-author, working them will significantly help the residents. Now that we have seen the major hurdles like lack of time, motivation, and some of the factors which will help, we analyze what were the other research catalysts which will help residents. The first in the list, we have the research methodology workshop, which is organized in every institute, and we'll see the rest. First in the list, we have the write-a-thon. Thesis writing can be a daunting and lonely task for a lot of people. And write-a-thon is an intensive writing workshop which is organized 3 times a year, and it provides a supportive environment to set realistic goals, plan writing schedules, and to stay focused. 3 to 4 months ahead, we get the write-a-thon announcement. And during the preparation time, project decision is done, literature search and manuscript preparation is done. And 1 month ahead, we get reminders. And on the submission day, our mentors are always available with us to answer all our queries. And a room with Wi-Fi access and Grammarly access is given. Final editing of manuscript and pictures are done, and the manuscript is submitted. And finally, we wait for acceptance. This is the data from our institute over the past few years. Next in the list, we have Wall of Fame. Residents who have published their thesis make it to this prestigious wall, inculcating the spirit within the community. This is the wall, and these are our residents. Next, we have the first publication award, where young researchers are recognized for their contribution, and they are awarded during the annual hospital day function. Implications: although thesis work is mandatory in residency, only a few of them make it to journals. Despite doing quality research, work goes unrecognized. Actionable insights derived from this study can go a long way in addressing challenges and converting thesis to publication. Thank you.
Very useful and insightful study. I think
Yes,
it
sir.
will motivate all other
Yes, sir.
residents also to take up publication.
Yes, sir.
During this write-a-thon
Yes,
that you conducted,
yes, sir.
how many hours students were writing?
It's organized for 2 to 3 days. Whenever we have festivals coming up like Diwali or Pongal, the OPD is generally tends towards the lower side. So we utilize this time to productively use this time. So 3 to 4 days we are given time from morning till night. The halls are kept open and residents are encouraged to participate.
Okay, that's very good. Thank
Yes,
you.
sir. Thank you, sir.
Very nice.
Yes, sir.
Need of the hour.
Yes,
I
sir.
must say, the initial slogan was publish or perish, and now it is converting to publish and flourish.
Yes, sir.
Okay,
Yeah.
so this is very relevant. Just tell me, whenever we think of writing, we feel the work is already done.
Yes, sir.
Okay. So, what should you do to get the idea? Apart from what your mentor says,
Yes, sir.
if it has to be inquisitive from you, what will you do to get the idea? What should be the topic?
Yes, sir. I think it's just seeing others which motivates us is what I actually feel.
Apart from motivation, talk science.
We should be interested in our work. Thesis is something that we do from day one.
Oh, okay, you are
Yes, sir.
interested.
Yes,
but
sir.
topics I'm asking.
Topics. More scientific topics which we feel that will make a significant difference in the community.
You subscribe to e-table of content of
Yes, sir.
all medical journals. That
And
is
see what
free
is
of
actually
cost.
happening. Yes,
That
sir.
you will know what is going on
Yes, sir.
around.
Yes, sir.
E-table of content.
Contents. Yes, sir.
So that will give you fair amount of ideas. Just now it has been published.
Yeah.
So why I should not be there in that list?
Yes, sir. Definitely. Yes, sir. Thank you.